Guys. My name is Bobby Huff, and I'm here today to talk to you guys about atrial fibrillation. So, what is atrial fibrillation, or AFib, and what happens during atrial fibrillation? So, atrial fibrillation is a quivering of the heart, or an irregular heartbeat, or an arrhythmia of the heart. What happens during atrial fibrillation is, so normally your heart contracts and relaxes, but with AFib, the atria, or the upper chambers of the heart, holds blood, and it begins to quiver or beat irregularly. Thus, the blood doesn't move regularly into the ventricles or the lower chambers of the heart. So, with that said, incredibly, a 2009 survey suggested that only 33% of the patients who had AFib thought that it was a serious condition, which is pretty interesting, according to the MayoClinic.org 2017. Some facts about atrial fibrillation are that 2.7 to 6 million people in the U.S. have AFib. The disease cases increase with age. Women are more likely to live longer than men. However, women are more likely to experience atrial fibrillation. There's over 750,000 hospitalizations each year due to AFib. It contributes to over 130,000 deaths each year, and it costs the U.S. $6 billion each year to fund, with patients who have the disease paying nearly $9,000 a year more than someone without the disease. So that's pretty interesting. Some signs and symptoms or warning signs of atrial fibrillation include reduced ability to exercise, weakness, fatigue, lightheadedness, dizziness, confusion, shortness of breath, or chest pain. And according to the MayoClinic.org, additional signs and symptoms include palpitations, which are a sensation of racing, uncomfortable feeling in the chest, irregular heartbeat, or flip-flopping in your chest as well, with the most common symptoms of AFib being the irregular or quivering of the heart or a fluttering heartbeat, according to heart.org 2017. The diagnosis for atrial fibrillation is, well, first off, your doctor will review if you've experienced any signs or symptoms. He could conduct a physical examination, as well as ordering the following tests: EKG, which is the primary test for the diagnosis, a Holter monitor, which you'd wear, you strap it around your chest. It would monitor your heart's activity for a 24-hour period, as well as blood tests, exercise stress tests, or chest x-rays as well. Additional diagnoses of atrial fibrillation are an echocardiogram, which is a test that can be ordered by a doctor to diagnose AFib. Echocardiogram is when a flexible tube is inserted into your esophagus. It travels down near your heart and uses those sound waves to basically take pictures of your heart in order to detect blood clots, says the MayoClinic.org 2017. Risk factors of AFib are age, heart disease. Anyone with a pre-existing heart disease could be at risk. High blood pressure, obesity, family history, just to name a few, as well as other conditions like thyroid problems, diabetes, metabolic syndrome, lung problems, chronic kidney disease, as well as sleep apnea. So some additional risks or risk factors for AFib are viral infections. Ironically enough, if you have European ancestry, abnormal heart valves, exposure to the stimulants that we love on a daily basis, caffeine, alcohol, tobacco, and other medications. And in addition, although rare, there's something called the lone atrial fibrillation, which is not related to having heart defects. The cases are rare, but it could happen. So, with that said, how do we reduce risk and or manage if we have AFib? Well, in order to reduce the risk of atrial fibrillation, we engage in regular exercise or regular activity, eat healthier foods, keep sodium low, monitor cholesterol levels, monitor sodium or blood pressure rather, avoid smoking, avoid excessive amounts of caffeine or alcohol, maintain healthy weight, and as I said, maintain cholesterol and blood pressure, just to name a few. Now, if you have AFib, you can manage symptoms by doing the following. You can take medications like warfarin, which is going to be a blood thinner, which is going to help you to avoid blood clots. No surgical procedure or non-surgical procedures like electrical cardioversion, which is basically a heart rhythm reset. They hook up electrodes to your chest and they try to basically shock your heart back into rhythm. Now that's a non-surgical procedure. A surgical procedure would be including or would have like a pacemaker installed, for example. So that would be if you were managing AFib with the condition. So let's go through our case study here. We have 60-year-old Edna Mae. She's a patient with emphysema as well as atrial fibrillation. She has a previous history, as noted, of having emphysema. She also has AFib. She weighs 130 pounds. Her height is 5'4" or 163 centimeters. She has no previous history of exercise, and she's looking to incorporate exercise for the management of her emphysema and AFib. She has no family history of heart disease. She is on medications. She's on warfarin, which is a blood thinner, which is helping her avoid blood clots, and that's for her AFib. She is a former smoker, and her blood pressure is 114/72. Let's assess her risk stratification. Let's go through and see what risk group she's in. Let's assess her goals and any special considerations that we need to keep in mind when exercising her. So Edna's previous history of emphysema and atrial fibrillation means that she is at risk, obviously. Her BMI, although BMI is usually inaccurate, does not put her at risk. Her family history does indicate that she is not at risk. Her current medications for AFib indicates that she is obviously at risk. Edna's history of smoking also indicates that she is at risk, as well as her blood pressure seeming to be stable. She's not at risk there. So, due to the current conditions or her current health conditions with having emphysema as well as atrial fibrillation, a history of smoking, and the fact that she's on medications, we would say that she's at moderate risk. So, any special considerations, or rather, let's talk goals. So, her goal would be to gradually improve aerobic exercise and submaximal endurance. The special considerations during exercise would obviously just be to monitor blood pressure, monitor intensities, and make sure that the exercise intensities are below a ischemic threshold, as well as making sure that she takes any medications prior to exercising. So that's our case study. Now let's talk about an exercise prescription for Ed. So let's start with the warm-up. Simply enough, we do a 5 to 10 minute warm-up. We'll say elliptical. Resistance training or weight training wise, we'll use the FIT principle. We'll also use that for the cardiovascular exercise prescription as well. So weight training, we're going to say frequency 2 to 3 days per week for 6 weeks. The intensity is going to be on an 11 to 14 on the RPE scale. The time will be, or for time rather, we'll use 1 to 2 sets of 8 to 10 reps. And for the type, we're going to do resistance training. The resistance training with the bands, stability ball, and machines. We're going to make sure that we're utilizing or we're working large muscle groups. For the cardiovascular or aerobic exercise prescription, we're going to do a frequency of 20 to 60 minutes per day. Intensity is going to be 11 to 16 so on the RP scale, or 40 to 80% of the heart rate reserve. We're going to do this 2 to 3 times per week, and we'll do 6 weeks. The type is obviously it's cardiovascular or aerobic, but we're going to be doing walking, light jogging, ergo bike, or treadmill even. Any contraindications to the exercise would be just making sure that our blood pressure is responding normally and that there's no other symptoms present, like shortness of breath or any chest pain, anything to where we would have to cancel exercise. Cool down periods for both resistance training and exercise training will end with a 5 to 15 minute period of static stretching, major muscle groups. Hold to the point of mild discomfort as always. Nothing changes there. So in conclusion, atrial fibrillation is a disease which for some reason we were rolling out the stats saying that 33% of people don't consider it a serious condition, but it's a chronic illness. It's like stroke, heart attacks, and heart failure. It could spur them on. This disease also has many symptoms that are often not recognized. So, nevertheless, there's treatments and ways to manage AFib. Like we said, with medications like warfarin, which is a blood thinner. We have non-surgical procedures like the electrical cardioversion, which is just shocking the heart back to a normal heartbeat, or heart rhythm rather, as well as surgical procedures, which would be the worst case scenario, like installing a pacemaker, which regulates heart rhythm, or resets and regulates heart rhythm. Ultimately, people, it's on us to lead healthier lifestyles when we're young, eat healthier when we're young, move and exercise, and as well as get regular checkups. If we do this, we could help either avoid atrial fibrillation or at least manage atrial fibrillation. Thank you guys for your time.